Hello, everyone. Welcome back to Chai Chat and Community. I'm sitting here with my favorite cup of tea with a very special guest and talking about something and having a conversation that is very, very important to all of us. You know, on this podcast, we talk about things that matter to our lives, even though it feels a bit hush hush. Today, we are talking about UTIs. It's something so many of us go through, but we often suffer in silence or feel a bit embarrassed to ask silly questions. And to help us understand UTIs, which is urinary tract infection, better, I'm joined by Dr. Preeti Killen, who will help us understand our bodies a bit better. Thank you so much for joining me, Preeti. Always.
Thanks, Celia. Thank you.
I'm not going to ask you to introduce yourself because everybody knows you now. So let's get to the basics first. What exactly is UTI? Can you explain that in plain language? And how does a germ get where it is not supposed to be?
So UTI is usually bacterial infection of the urinary tract. So if you look at the urinary tract, if we just go in ascending order, it starts from where the urethral opening is, that is from where the urine comes out, right? And then the bladder, and it then is connected to the kidneys with the tubular structures, which are the ureters. So UTI is infection of the urinary tract, which could be the urethra, bladder, ureters, and kidneys. Most commonly, it is the urethra and urethral opening, urethra and the bladder.
Okay, if you were to explain this in Hindi, how will you explain this? How will you explain the urethra? Because we have such a huge multicultural community, and it's something that people may not understand what the urethra is.
तो यूरेथ्रा जो है वो ओपनिंग होती है जिससे कि हमारी यूरिन निकलता है ब्लैड, ठीक है, और यूरेथ्रल ओपनिंग वो होती है, बट यूरेथ्रा एक छोटा सा ट्यूब है जिससे कि यूरिन फ्लश आउट होता है ब्लैडर से जहां पे वो स्टोर होता है. सो दैट इज व्हाट इज यूरेथ्रा. और जो हमें वो व्हाट वी सी इज द यूरेथ्रल ओपनिंग, वो ओपनिंग है जहां से यूरिन निकलता है.
So we've all heard about the burn, but what are the other signs? And it's like if I have to go to the toilet every 5 minutes, but nothing is coming out, is it still UTI?
Look, UTI could present with various symptoms. It can start with frequency of micturition. You go out multiple times, just very little amount of urine comes. Most of it is held back in the bladder. Then there is a feeling of burning at the time of micturition. Yeah. Lower abdominal pain is also one of the things that you may experience. And when that infection is traveled high up, right, when it goes up to the kidneys, then you have symptoms of pain, fever, and then it can even lead to sepsis.
Yes, so and other things. That's a serious condition, isn't it?
Yes, that's a serious condition. So as I said, most of the urinary tract infections are limited to the urethra and the bladder, but that can ascend high up as well.
Okay, so this was my next question. When does a little discomfort become called the right now situation?
Look, it really depends. If you have a compromised immunity and, people who have diabetes, they have to be very careful that if they have any symptoms, you do not want them to, they should really go and get a urine test done or see their doctor for a prescription for antibiotics as well. But for most of us, I think we would know, when you have that lower discomfort, frequency of micturition, burning, very, very obvious symptoms of urinary tract infection. But sometimes it could be like asymptomatic as well. We do not know. That could be one of the things. But yes, if you've gone higher up, that will be with a lot of pain, fever, and other.
Okay. So, and I think this is something that I spoke to you about. You have all the symptoms and then you get tested, but you don't have UTI. So that is something that I struggle to understand. I know I have been through this and it has happened most recently in the last couple of years where you think, oh my God, all this burning and what am I doing? Do I need to go to, I always go to the doctor. So, but it is not UTI.
But
What is it then?
sometimes you may need a repeat test as well. Sometimes
Yep.
this comes out as contamination and that test may need to be repeated. And other times you just have to just manage, with the things. Definitely get the test repeated is my advice. Manage with things like increasing your water intake. You could take some things, like Ural, which can just alkalize the urine, change the pH, make you feel better. So, and then if it doesn't subside, then I think we would have to look into other causes as well, maybe a gynecology check for a woman and maybe an imaging, for the kidneys and bladder. So these are the things but again, first thing, I think a urine test is often needed to be repeated in a few days interval.
And is the urine test, does the result come out immediately?
No, it takes, 48 to 72 hours. So that is the reason, that is the thing, that if people have any sort of compromised immunity, sometimes they would be started on antibiotics, just because you do not want that infection to go higher and ascend and, before. And then obviously, once the results of the urine infection come, the culture sensitivity comes, the antibiotics can be changed accordingly, depending on what it shows.
So here is something I hear a lot, and I think when I sent you the questions, we have so many cultural myths, and I'm going to talk about prevention and what we can do. So in many communities, people think UTIs come from being dirty or even eating certain foods. Can we clear the air about, is it hygiene or is it just biology?
So UTI, look, definitely, poor hygiene can contribute. But even people, who maintain good hygiene can have UTI, So there are some risk factors which we can take into account. First is drinking less water. If your fluid intake is not adequate, constipation, pregnancy increases the risk of UTI, menopause.
So pregnancy increases the risk of UTI. You obviously can't have antibiotics at that time. What do you do then?
So you can have antibiotics.
Oh, you can have antibiotics.
Yeah. It's just, we have to have those antibiotics which are safe to be taken in pregnancy.
Okay.
Diabetes, and also, yes, not good hygiene practices like bad wiping techniques, always the wiping. Yeah, the wiping has to be from the front to the back, not from the back to the front, because, you're just getting the bacteria and trying to, introduce it to where it should not be. And immunocompromised people, and also sometimes children with some sort of congenital malformations, and also children who do not completely empty their bladder. Again, those are the practices which have to be taught to children, and some urinary tract abnormalities. So these are some of the risk factors for urinary tract infection.
And I think when you talk about, washing yourself and keeping yourself clean, now you can wash yourself with water, and so many of us do it instead of just using toilet paper, isn't it?
Yeah, and there are bidets, in many homes, and many people are looking into that. And of course, that is a good technique, but just, correct, good hygiene and correct wiping techniques are very important to be taught, from childhood.
Yeah. So does holding it during a really long shift, if you have work and you can't go, or a busy day at home, actually, does it cause an infection?
Yeah, what happens is, look, because holding the urine in the bladder for a long time, the urine becomes stagnant.
Yep.
And that decreases the chance of the bacteria to flush out, right? But if you have more water intake, go for your micturition more often, then that bacteria will be easily flushed out. But once the urine is held in the bladder for a longer time, it becomes stagnant more easily. The bacteria which is there does not flush out, and more chances of developing an infection.
So you should never ever hold it. Doesn't matter how many times you need to go to the toilet.
That is exactly, that is true. Yeah.
I mean, I know my first problem started because I had an 18-hour flight from Delhi, and I didn't go to the toilet at all because at that time we didn't have direct flights. So, yep. And it was terrible. I think it was the worst time I went through. So, yes. So this was my next question is that, we hear about drink more water. Does it actually wash the germs away, or is it just an old wives' tale?
No, drinking more water, definitely. What happens is that because if you drink more water, you would empty your bladder more frequently, and that does wash the germs away. Yeah, because the longer they stay, more chance of them to multiply and cause infection.
Absolutely. So let's talk about treatment. So does cranberry juice actually cure UTI, or are we drinking more sugar for absolutely no reason?
Look, cranberry juice, that is, it has mixed evidence, but the benefit is modest, right? So that's what I'll clearly say. The benefit is modest. So cranberry juice, what happens? It has certain substances which prevent the bacteria from sticking to the bladder wall. It does have a high quantity of sugar, so have to
very high.
Yeah, in patients who are diabetics or have impaired glucose tolerance. It does not cure urinary tract infection. Once you have the infection, it has to be cured by antibiotics. But it can prevent, because as I said, that it can prevent those bacteria from sticking to the bladder wall because of the certain composition of the cranberry juice. So yes, it does have some benefits, definitely.
But it's not a cure.
No, it's not a cure. It could be a prevention for people who have recurrent UTIs. Yeah.
So why is it so important to finish a whole box of medicine even if the pain stops after a day?
Yeah, but what happens is that we usually respond to antibiotics within 24 to 48 hours.
Yeah.
Right. So you would feel that, you never had anything, but just to eliminate all that bacteria, we do need to complete our course of antibiotics for infection of the urethra or the bladder, which is most commonly, one of the common cause of UTI. We should take the full medication for at least 5 to 7 days.
Okay. Thank you. And are there any home remedies that we can use in case we can't go to the doctor, or in case, and I think for most of us, it's like waiting for the results because, as you said, it can take between 24 to 48 hours. And in that case, should we just have Ural? How effective is it? Or is there any home remedies that we can use?
Look, you have to look at your symptoms. I don't think if there's an infection, home remedies can't treat it, right?
Yep.
But yes, taking, heat packs and, just being comfortable with whatever you are to just elevate your pain, all those things can be done. But, and as I said, that sometimes if your symptoms are really severe, you may go and give a urine culture, but your doctor will be happy to start you on antibiotics. Right. Then wait for the results of the culture. And of course, if you need you need a change of antibiotics, depending on the sensitivity, that can be done.
Okay. Thank you. So, there's been we now know that for UTIs, you can get medication. I don't know how you can get tested from the chemist, but there are specific chemists who disperse the medication. Can you tell us a bit about that?
Look, I think just because this has been the recent change, because, obviously women do not, and again, the same thing, that they would be expected to go and give, a urine sample in the lab. And I think this is just because of long waiting time with GPs and, poor accessibility. We do not want women, we don't want the population to suffer. And that's the reason I think the government has been kind enough, to give that sort of, some pharmacists have been licensed to prescribe antibiotics, But of course, I'm sure it is all done with a lot of caution.
Here, of course, yes.
Yeah. And I don't think everybody, but I think quite a lot of pharmacists are accredited to do that now.
Yeah. Okay. So last question. So do our risks change as we get older, or when we are having, expecting a child? Why does our bodies become more sensitive during these times?
Yeah. So we'll start with pregnancy. When a woman is pregnant, what happens is that the pregnancy hormones, the progesterone, it relaxes. There is a tendency of relaxation in the whole of the urinary tract. There's a relaxation of the urinary tract. And that's why there is, the emptying of the bladder is not as much. So again, that predisposes to urinary tract infection. Then the other thing is that the composition of the urine also changes in pregnancy, so more susceptible to infection. And also the pressure from the pregnant uterus, it presses on the bladder, and sometimes it leads to incomplete emptying. So these are the reasons, why, urinary tract infection is common in pregnancy. Now, coming on to the extreme of age is menopause. Now, we have to remember that as, we grow older, menopause, it deprives the woman of estrogen in the body, right?
Yeah.
We know that, and that's
which is a problem for everything. It's
a problem for everyone, and this is something which nobody can choose and avoid. So estrogen receptors are around the vagina and around the urethra as well. That is the opening from where the urine comes out. It keeps the vaginal tissues thicker and healthier, right? More of the protective bacteria are there with the estrogen, in estrogenized women. And as we grow older, because the estrogen content gets depleted, the tissues become thinner and the protective bacteria are not there as much. And all these, predispose women to more urinary tract infections.
And yeah, it's just, it's like every single infection that you can think of. I want to ask you one last question.
Yeah.
Because this is something that we used to think about a lot when we were young, is that when you use public toilets, can you get infection from there? Do you get UTI from there? Because I did ask one of my GPs and she was like, no, but I want to hear it from you. Whether
look, again, it comes to poor hygiene, isn't it? I mean, what we tell people that when you use public toilets, I mean, of course, you may have to use it. Just, I think, just even, cleaning the toilet seat or, putting, toilet paper on that, clean toilet paper, all these simple measures can help. So it could be possible, it depends. I mean, not that it could be a direct source, but again, it comes to poor hygiene. So that's what I would say that, I teach my children as well that when you have
We've been taught that, yes.
Yeah.
Many of us do the camel pose also.
Yeah, that is true. That is true. Yeah.
So, and especially when you're traveling and you don't know, and you go to small towns and there are no clean toilets, you have to use public toilet all the time. I mean, yes. So I think, yes. So thank you so much, Preeti. I mean, for me, you've turned something that felt like a scary medical mystery into something we can actually manage. And to everyone listening at home or on your commute to work, I hope this conversation made you feel a little more powerful and a little less alone. Take that extra sip of water today. Listen to what your body is telling you. And remember, your health is your wealth. Until next time, keep your heart and your teacups full. Bye for now. And Preeti, thank you ever so much.
Thank you so much. Thanks.
Thank you. Bye.